So as a continuation to last month's vlog, we're going to add a little TMJ treatment. So last time we just did some basic bone work. So if you haven't watched that, that's a really good thing to watch because you want to do start with the basic bone work. But if you're a sufferer of TMJ or jaw pain from clenching, grinding, there's all kinds of dental atrocities that people suffer in their lifetime, like myself. I had braces, had my wisdom teeth pulled. I think we all have pretty much. And, those things can have consequences on your bite, and your structure, and your balance. So again, we need to get everything balanced. We need to get everything released because the jaw also has a direct link to your hips. So when your hip and back is tight, and to remind you, Matthias first came to me for back treatment, and yes, we want to clear all this stuff in his head, especially his jaw. So when his jaw starts to tighten up, it's time to pay attention to what's going on in his low back and his hips. So I'm going to do just a really quick lift his frontal bone, spread his cheekbones. We always start with basic bone work, and I'm just going to stay here. I've got the larger ball behind the head, as always. That's going to be for the occiput, and I'm going to get that nice and stabilized, and I sink down there. So I'm going to lift the frontal bone just quickly to prepare. So he's all prepared because we just did a face session on him. And we're going to spread. And I'm going to spread on the left. Good. And I'm going to do a quick second release here. So I'm going to spread into the side of the nasal bone. I grab the cheekbone. And I just want to give this quick little opening here. All the way out to the ear. And once you get to the ear, it actually feels really good to just spread right on the ear. So now I'm going to take it to the left side. I'm going to sink in here. And I'm going to sink down and spread out. I've got my gloves on for a reason. Because we're going in. We're going to go inside of his mouth here in a second. And I'm going to spread. Okay, so that's just a quick little preparation. I'm going to lift under here real quick. And on this side. So he had reported to me that he was having some left-sided jaw pain. So we did the basic bone work. And we just lifted and spread his forehead and his cheekbones just to prepare for this deeper work. So the first thing we're going to do is I'm just going to have him open his mouth. And I'm going to just take my finger, my pointer finger and my thumb, and I'm going to grab just above the tooth and gum. So this is all bone here. So I can do it on both sides here, like so. All right, I'm going to hold his jaw stable, and I'm just going to spread out. So it's like so I'm going to be like arcing out around the shape of his upper teeth, which is actually the bone structure where your sinus cavity, your nose connects to, your nasal bone connects to this bone. And I'm just going to widen and spread. So I'm doing this to him, but he easily could do this on himself. So this is a lesson for him. I'm giving him a lesson on how he can work on his own TMJ. So you need a face ball so that you can do this. And then you're going to glove and go in, or if you're working on yourself, you don't need to wear gloves. But I'm getting back, I'm going to use this finger now. It's easier to reach his back teeth, and I'm spreading out this way. Now I'm going to go to the other side. So when you're doing this on yourself, you can spend a little bit more time. I'm kind of speeding up the process, but I'm trying to be, effective. But if I were doing something and I found that I had some jaw pain, I might hang out a little longer in each one of these spots. So this is really good. Oh, I can feel where it is already. Feel that right there? Okay. So I'm going to do the bottom teeth now. And same thing, we're going to go for the bone and we're going to spread and spread and spread. Make sure he stays nice and stabilized on this side. It's also a little bit of traction out to kind of just relax that clench of the jaw. I'm center. I'm going to go to the other side. So when you do this on your own, you figure out which hand works better. I tend to use the one hand on the opposite side of the body. And I spread. Actually, this side's tight too. So this is just quiet work. It's just getting the impact out. So that's real simple, right? So that, and it might not feel like a whole lot's going on, but doesn't it feel different after I've stopped? Mm-hmm. Okay. Next thing I'm going to do, and this is just super simple, and you're not going to be able to see it on film, but so let me describe what I'm doing. I usually take one finger, two fingers, it could be two thumbs, it could be a pointer, and I'm going to put one on his bottom teeth and one all the way back as far as I can get on the molars towards the back teeth. And I'm going to traction and spread in both directions. So let's just start on the right. So there, and you're just going to relax, and then I'm just going to increase this traction. That's not too bad, right? Good. But as I just hold the traction, as I feel it give, I can increase the pressure slightly. This is not hard to do, so you can easily do this on yourself. And let go. Feel how that just kind of relaxes it a little bit? Mm-hmm. Okay, we're going to do the other side. So I'm going to use my pointer and my thumb, and I'm going to go back as far as the back of the teeth are. And even if you wear dentures or you have crowns or mouthpieces or even removable things or there's no tooth at all, go for the bone. And you just spread. Just let go. So you feel this give. That's what I would describe it. And you'll feel it when you're working on yourself. You know when it gives. But I could feel his body relax, and I could feel the joint let go a little bit. Okay, you liked me until this moment. So now I'm going to elicit a little bit of discomfort. So I'm going to go for these. So that's basically what you can do. And I'm going to go back here, and I'm going to go between the tooth and the gum. I'm going to go all the way to the back here. And I'm going to, this one's just kind of holding the jaw. This finger is going to go back behind the tooth, and it hooks back there. And there's a little space that you can dive into right there. Feel that? So see, so you feel there, you go right back there. That's where your jaw and your upper teeth and lower teeth come together, the two bones come together, and that's your TM joint. And then I just hook that finger in towards the upper teeth behind the last tooth and wait. And it doesn't feel good, does it? And then I just come out. But that muscle gets super tight. They're called your pterygoid muscles. And so I can spread down. I'm going to press in here. And this side's a little different. Okay, I'm going to go find in there. Good. Okay, now another easy way that you can do it. So because sometimes when you treat yourself and something hurts, we don't put enough pressure. So what I do, and this is actually the quick fix for that, is I'm going to put my finger all the way to where the lower jawbone and the upper maxilla, which is called your cheekbone, come together. And it's behind the back teeth. So I'm going to ask him to bite down. And I press my finger where those two bones meet. I'm going to add a little pressure, bite all the way down. You won't bite my finger. There's space back there. Obviously, I'm not having it between the teeth because you bite my finger. But right there, now release it. And I'm going to straighten his head out again and bite down. And I'm gently pressing. Might not feel so gentle because it's very tender. And release. I'm going to do that on the other side now. Give you a break here for a second. Okay, ready? Okay. I'm going to find that behind the molars, behind the back teeth. And literally, if you go straight back where those two bones come together and just wait. And now I'm going to ask him to go ahead and bite down. That brings those bones closer together. I've got that finger in there, so it's sort of like a springing action. It's making space in the joint. Now relax it. So if I press down, I'm spreading down the mandible or your jawbone. If I press up towards behind the upper teeth, I'm right in that TM joint, and then I can slide right in those pterygoids. This is the side that's tight. So I'm going to have him bite down again. So you can just explore inside your own mouth. If you're not sure, it's always, maybe just get an anatomy picture and look, and you can release that. And we're going to let that go. That give you some relief? Mm-hmm. Good. So that's a TMJ treatment. I have that whole protocol on YBR Anytime videos on my online subscription, and see a practitioner in your area if you're lucky enough to have a YBR practitioner. And thank you for watching today.